Pulmonary thromboembolism is the third most common cardiovascular disease after an acute coronary syndrome and even stroke, with an incidence of 112 cases per 1 lakh in the general population. It is relatively common and even potentially fatal, a medical emergency which is causing more than 1 lakh deaths annually. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to discuss about how a prolonged hospital stay period might affect or rather increase the risk of pulmonary thromboembolism. Patients with pulmonary thromboembolism are commonly admitted to the hospital and generally or usually have a very prolonged hospital stay. Now, the researchers have aimed to determine whether the different clinical and laboratory parameters that are associated with a prolonged hospital stay, and also have understood or rather analyzing the effectiveness of pulmonary embolism severity index score as a predictor of prolonged hospital stay in patients with pulmonary thromboembolism. The study that I'm talking about is published in the Journal of the Associations of Physicians of India. An observational prospective study. It confirmed the cases of pulmonary thromboembolism, all those who were defined as patients with evidence of a thrombus when examining on their CT pulmonary angiogram. Depending on the length of the hospital stay, the patients were divided into two cohorts. One was shorter hospital stay that was less than 10 days period, and the other one was a prolonged hospital stay which included a stay which was beyond the period of 10 days. In this, a total of 150 patients were included, with 44.67% patients having a shorter hospital stay and 55.3% having prolonged hospital stay. It was hence concluded that pulmonary embolism severity index class can be effectively used to predict the prolonged hospital stay in patients with pulmonary embolism. Also, patients with hypotension at presentation, decreased level of consciousness and ECG abnormality are more likely to prolong their hospital stay. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.